everybody. Welcome back to the ANJC podcast. I am your host, Dr. Mike Acanfora. Today, I'm thrilled to have on my good friend, Dr. Joseph D'Angelillo. Doc, how are we doing today?
Doing great, man. How about you?
Fantastic. A full day of taking care of patients, and then I get to do a podcast at night, and we got a lot of ground to cover, so I'm excited to have you on.
Beautiful.
All right. Dr. Joseph D'Angelillo has dedicated more than 40 years to chiropractic care, education, leadership, and advancing the profession. He graduated summa cum laude from Palmer Chiropractic College in 1984, where he was honored as a recipient of the Daniel David Palmer Scholarship and served as a senior X-ray intern. Prior to chiropractic school, he earned his Bachelor of Science degree in biology from St. Peter's College in Jersey City. Since beginning his private practice in 1984, Dr. D'Angelillo has cared for generations of patients at D'Angelillo Chiropractic Center in Somerset, New Jersey. His postgraduate educations included advanced training in spinal rehab, radiology, chiropractic pediatrics, geriatrics, whiplash injuries, biomechanics, extremity adjusting, and the Cox flexion distraction technique. Beyond clinical practice, Dr. D'Angelillo has been deeply involved in organized chiropractic. He's held numerous leadership positions within the profession, including serving as president of the ANJC from 2011 to 2014. He's also served as chairman of the ANJC Legal Committee and has contributed many years of service on committees focused on education, finance, awards, and professional advancement. Dr. D'Angelillo has authored and contributed to numerous publications, including case reports exploring conservative chiropractic care for complex spinal conditions. His work has appeared in professional journals, including the American Chiropractic Association Journal and the Journal of Chiropractic Medicine. Today, we are excited to hear about Dr. D'Angelillo's journey, his experiences in practice, his leadership within chiropractic, and the lessons he's learned throughout a remarkable career. Doc, welcome to the show.
Thank you for having me, Mike.
That is fantastic. That is one heck of a career, Doc. I really appreciate you coming on. I appreciate our friendship and your leadership over the years. Joe, the first question I ask people is, why chiropractic? What drew you to the profession?
Well, it's an interesting journey to how I became a chiropractor. I injured myself playing high school football. I actually felt like I had a lit Cuban cigar being ground out at the corner of my neck, with pain shooting down my right arm, numbness and tingling in my thumb, index finger, and middle finger of my right hand. And so what did we do back in the day? Saw our family doctor, who gave me some painkillers, anti-inflammatories, referred me to an orthopedic surgeon, saw a neurologist. So after about 3 years of going through this referral wheel, I was in no better condition. And I was in college at this point, and I had a friend who basically, after finding out that I had this problem, said, well, have you ever seen a chiropractor? I go, no, I don't have arthritis, because my grandmother was going to a chiropractor, loved him, but she said she was going for her arthritis. I thought chiropractors were arthritis doctors. So I made a big change and saw a chiropractor, and the rest is history. Got rid of all my problems that I had at the time and led into going to chiropractic college.
Do you remember who that chiropractor was back then?
It was on Milltown Road in North Brunswick.
Wow.
Yeah.
That's exciting.
He's
cool.
No longer with us.
God rest his soul. So when did you become involved in the chiropractic societies, and why did you become involved?
I come from a family of volunteers. If you actually talk to any of my family or people in our community, they'll tell you about the volunteerism of my parents. Really, they were great leaders as far as doing the volunteering thing. When I was in Palmer, I was a member of the New Jersey club and became treasurer there, and it had a connection to the NJC. Upon graduating college, I became a member of the NJCS shortly thereafter. And I got involved in the Industrial Relations Committee. And in the Industrial Relations Committee, we created a back school program called the Industrial Back School. I helped write the program and I helped edit the program. and we went around teaching not only doctors in New Jersey, but Pennsylvania. We wound up setting up a referral committee for local businesses. And we donated our time to teach injury prevention in the local corporations. And it basically was a win-win. It actually reduced their on-the-job injuries, which reduced their insurance rates. And we actually helped fund some of the activities of NJCS because the fee that we would charge the corporation came back to the NJCS. From one thing led to another, got involved with the Central Jersey Chiropractic Society. And again, rose through the ranks, was fun. We had monthly meetings. It was, educational and camaraderie at the same time. Shortly thereafter, we started talking about this thing called Unity. An organization called the Forum sprung up. And from that, we developed a treatment protocol because all of a sudden managed care was coming in. Yep. So we were involved in trying to create some reasonable treatment protocols that the profession could stand behind. And ultimately, we formed into the ANJC after several renditions of the forum. Then I became a member of the ANJC, same role. I got onto the board, started getting pulled to volunteer for this committee, that committee, and one thing leads to another, and here I am.
And here you are. You served as, you rose through the ranks, and you're being very humble. You served, and then you became president of the ANJC as well.
Right, yes.
Remarkable. You did your parents proud with volunteering because your career and what you've done for the profession is nothing short of remarkable. It's a big deal. So thanks for doing that, Joe.
Well, you're welcome. Thanks. It's been fun. It really has been fun because one thing leads to another. You get involved, you rub elbows with different people, and they become your friends. And it's easy to help your friends, really, what it comes down to. And it's been collaboration among friends.
Yeah. What's that saying? I think it was Gandhi, be the change that you want to see in the world. And when you're doing it with your friends and colleagues, it makes it so much easier and so much fun. And having been on the board for only a short time and working behind the scenes for years, I can echo your sentiments. Board meetings are a lot of fun. Anybody in the New Jersey profession is allowed to come to our board meetings if they want to observe. But it's been great. So I want to thank you for paving the way with that.
You're welcome.
All right, Joe, what recommendations would you have for young practitioners just starting out in practice?
Oh, there's a lot of recommendations. Practicing chiropractic today is certainly different than practicing chiropractic when I started. Back in the day, there weren't very many choices, right? You were going to become a chiropractor. You're either going to be in a solo practice or a group chiropractic practice. Yeah. And so aside from, the nitty gritty of the business aspect of practicing, I think the one thing I can say that helps me, and I think it helps most people, is just have confidence in your uniqueness as a chiropractor. People, they come to us because we are different. We see healthcare from a different perspective. They have been through allopathic care. And in the past, it used to be they'd walk in with a handful of stacks of reports and MRIs and x-rays. And I don't see that as much anymore as I did in the beginning. They have confidence in us. We are mainstream chiropractic. Be confident in what you do. Be confident in your uniqueness as a chiropractor and promote that. They don't want you to be like the MD down the street. So leave all that stuff behind. Focus on your mission as a chiropractor, and you will be successful.
Absolutely. Love that. Thinking off the top of my head, you have an extensive background in publishing work you've done. Is there any interesting cases that you can share with our listeners?
Sure. I've had so many different interesting things. You never know how you're going to touch the world in a sense. I'm just going to give you one little anecdote. this goes back to probably within the first couple years of being in practice. It was a Saturday, and a fellow walks through the door, and there was a cardiologist internist who was practicing next to me. She had closed up. Practice was complete for the day. I was just doing some paperwork. And he walks in and he goes, I have an earache. I want to see the doctor next door. What can I do? I said, look, come in the back. I'll look in your ear. It's when my otoscope was fully functional back in the day. Look at his ear. I told him, look, you don't have a ear infection. You probably just have a blocked eustachian tube. Chew some gum. And I told him I'm a chiropractor. This is what I do. And he told me he was getting on a plane that day and flying back home. And I thought he was flying back to India. Turns out he was flying back to Saudi Arabia. Literally 1 week to the day, we get a call in the office for a person who wanted to make an appointment. They had sciatica, and the receptionist is going through the litany of, okay, give us your address. Saudi Arabia. Well, how were you referred here from Saudi Arabia? So it was this gentleman went back home, told his friend who had been suffering from sciatica for 3 years about this profession called chiropractic in the United States. The gentleman comes in, and that office had a long hallway, and the first seat by the door he was sitting in, a big smile on his face. And I said to the receptionist, he looks happy. I mean, she says, you didn't see him walk in. He walked in at a 90-degree angle. He couldn't stand up straight. And he was working through 2 interpreters. He had interpreters with him. And doing the exam, and this guy was in extreme pain. He had bilateral sciatica all the way down to the feet on both sides. Had been that way 33 years. He was 34 years old.
Wow.
He came in with x-rays, a stack of x-rays, like I said before, how patients used to do it. And his x-rays did not line up with what my examination was showing me. So I decided to take some x-rays. In the case history, he had put down that he had tested positive for TB. So the x-ray showed a big fluid line in the joint space of like L4, L5. You couldn't even see the disc, and the fluid went all the way off to the side. It was pus. So he had an osteomyelitis of the spine. It was Pott's disease, something we don't see in the United States anymore. I called up an orthopedist that I knew. I said, look, I have this guy in my office. He obviously has an osteomyelitis, and let me send him over to you, but he's tested positive for TB. He goes, oh, don't send him to me. So he says, call Columbia Presbyterian. We did. They couldn't see him for a week. But the exam revealed that the reason he couldn't stand up was because his SI joints were locked up. I discussed with him. I said, look, your SI joints are what's preventing you from standing up. We can give you a gentle adjustment, and we'll see what happens. Gave him a gentle Thompson drop adjustment. He stood straight up, and he was able to walk out of the office straight. He wanted me to see him for the next week until he could get into Columbia Presbyterian, which I did. Chiropractic is so good. His sciatica was easing up. He was like back to just pain in his buttocks by the time he left, but he did need to get antibiotic therapy ultimately to cure the Pott's disease he had. That's one. That's, it's not going to be the chiropractic. We cure everything, but, led a guy into the right direction who I looked in somebody's ear, and next thing you know, there's somebody walking through your door from far-flung places. I've had a whole bunch. I've actually had another patient who had an osteomyelitis too, the result of a tattoo. The guy got a tattoo, and it became a localized infection. He was working in I'm not going to name the hospital.
Yep.
And he developed back pain shortly thereafter, and they sent him for physical therapy. He had x-rays done. He had an MRI done. And physical therapy was electrical stim and heat directed to the area of pain, knowing he had a staph infection of the skin. It ultimately became a septicemia. They drove the infection to his spine. And again, the guy walks in being carried in, packaged him up, sent him back home. You need antibiotic therapy. But that patient, believe it or not, has continued with me since then, and I see him on a maintenance basis. And over time, I've seen the progression of the degeneration process that happens at that joint after an osteomyelitis. It just goes from one phase to the next to the next. And he really needed supportive care his entire life because of the joint dysfunction that occurred. So,
Sure.
just some bizarre things that have walked through the door. Another one that I had that was referred to me from by the VA was a 59-year-old Army person, female.
Mhm.
She was 38 years before she was shot in the spine.
Oh,
So she had an entry wound that was in the anterior left chest, crossed her body, impacted the L1, L2 level. She obviously had a lot of surgeries to initially to reinflate the lung. She had some internal damage to the pancreas and some other internal organs that they had to stop the bleeding on. And then she wound up having a bilateral laminectomy of L1, L2, debrided the wound and removing shrapnel. She had multiple surgeries over the years. She was a paraplegic for a period of time. She had some extensive physical rehabilitation while at the VA, ultimately got her to regain function of her legs. However, she
wow.
always had a level of pain. And when she entered my office, she came in on crutches. She had bilateral sciatica. She had really no perception of any sensation in her leg, just constant pain in her left leg that she rated at an 8. The sciatica in her right leg, she rated at a 6. So she had seen orthopedic surgeons, neurosurgeons, neurologists, pain management, physical therapy, internists at the VA over the course of 38 years. And she really had reached a plateau. She thought that was her life. When she would go into the swimming pool, she needed to wear weights on her left leg because if she didn't wear weights on her left leg, it would float up because she had like no motor control. So she came in with MRIs of her spine that actually had been performed a month prior to her coming into the office. Doing the exam on her, you can imagine there was like total anesthesia of the left leg. She had a knee reflex in her right patella. She had like a +1 at the right Achilles, but her left Achilles, left patella were 0. There was nothing there.
Wow.
She had total anesthesia of the left leg with pinprick, no sensitivity, no sensation whatsoever. I started her gently with the coxflexion distraction technique. And if anybody knows anything about cox, you go through different protocols. You always want to work within somebody's tolerance level to be able to tolerate the movements and the motions. So she was able to tolerate protocol 1. And since it was such a chronic condition, I said, well, let's see how she can deal with protocol 2 on her first visit. She couldn't tolerate the motion going towards the left side. She could only tolerate going to the right side. So we did a protocol 2 on her for day 1. Day 2, she was able to tolerate both sides. After a month's worth of care, I was only seeing her twice a week. Again, it was a chronic condition. I wasn't wanting to run her through a lot of treatment at the get-go. So I did sort of like a moderate treatment protocol with her. After 1 month's worth of care, she's feeling pretty good. She said she felt about a 30% improvement from her initial complaints. After about 19 visits, which was stretched over several months, she no longer had sciatica in the right leg. She had
Wow.
intermittent buttocks pain on the right side. The pain in her left leg reduced from an 8 down to a 5. She was able to walk without crutches, didn't need a cane, and she was able to ambulate without the use of anything, no assistance whatsoever. Really changed her life dramatically. And again, she has a permanent injury, and it's something that, again, somebody's going to need supportive care the rest of their life to keep them as functional as possible. So
Sure.
people say, well, how did you adjust her around the area where she had a bilateral laminectomy? There's no spinous process to anchor yourself. So I created a cupping. I used my thenar eminence on the right side of her spine and the thenar eminence on the left side, contacting primarily the facet joints to gently mobilize her spine. And she was able to withstand the pressure and the distraction and progress very well. More cases, or is that enough for you right now?
That's amazing. And this is why, part of the reason why I really wanted to reintroduce podcasts so that people could come on and tell their stories. Chiros could come on and tell their stories, because we get these cases every day and we really don't think much about what we're doing and how we're doing it. But when you really dig into it, you literally change the arc of these folks' lives by the power of chiropractic, with your expertise behind all of that. That's remarkable, and people need to hear these stories, Joe.
And it doesn't just affect them individually. It
Right.
goes through every contact in their life.
Yes.
A month ago, I had a mother come in with her 9-week-old daughter who had been colicky since birth. And you could see in her face how it was wearing her down. She had a 2-year-old that she was carrying along with her as well, that, you could see the stress and the tension. The baby came in, was crying, wailing, and she had a torticollis. The baby had had a torticollis for 9 weeks. And she had done everything that a young mother knows to do, with the medical basis, talking to the pediatrician who saw the child shortly after birth, etc. What I did was a gentle toggle, using a baby toggle at the atlas.
Yep.
One toggle of the atlas, this child's head straightened out. I had the mother return in 2 days so we can follow up on it. She said that was the first time that the child had slept peacefully when she left the office, got in the car. Normally, the child was screaming in the car,
Yep.
and she was able to drive home peacefully. So the entire dynamic in the family is affected because of the one child constantly screaming. So you're right. It doesn't just, affect just that one individual. It's
Right.
affecting an entire family dynamic, or even coworkers, right? So if the woman is drained and having to go to work and isn't up to her par, it's affecting the entire work dynamic as well. So you don't know how far like the adjustment is going to go.
You really don't. A funny story, a remarkable story that I tell that happened in my practice was, one of my seniors asked me, do you think you could help my sister-in-law? I said, I'd be glad to check her out, take a look. So woman comes in, she's 40 years old, hard driving. She's studying for MBA. She's an accountant. She's planning to go for a PhD, and she has trigeminal neuralgia. And if you've ever seen somebody with it, it's called the suicide maker, because the pain is so excruciating. People wind up committing suicide. It's that bad. She was on 15 medications. So she comes in, she asks the doctor, my sister-in-law said, go and see my chiropractor. And the neurologist said, hey, you're wasting your time, but go ahead, just go see what he can do. So palpate her neck, feel what's going on, take an x-ray. And I say, Liz, let me tell you, your neck is really out of alignment. I'm going to adjust it. I'm going to be super gentle. But I can't make any promises, but I think this might help. So make the adjustment right on C1, so far rotated to the left. Adjust it. She literally jumped off the table and said, I'm going to kill him. And my first thought was, Joe, I can't get past her. She's in front of the door. And she says, I can't believe it. The pain is gone. I've been suffering and suffering and suffering, and the pain is gone. I was like, wow, that's remarkable. She goes, thank you so much. I cannot believe this. Tell me what I need to do. I will follow everything you say, every recommendation. I'm going home and I'm throwing out my medicine. And I'm like, I can't tell you to do that by law. You can do whatever you choose to do. So she comes back in the next week and she says, I threw all my medication out. I fired the doctor. I feel amazing. I'm not on any medication anymore. Well, the story in and of itself would have been remarkable if it ended there. But what she didn't know was at that time she was pregnant.
Wow.
She threw away all that medication. Her daughter just graduated college.
Yeah.
That's how long ago it was. It's remarkable.
Yeah. It
Remarkable.
is how you change lives.
Yeah, we literally do. I really appreciate you taking all your time out for us, Joe. I have one more question. How do you envision the profession 10 years from now?
I think the world is the chiropractic oyster, right? There is going to be, changes in healthcare overall, right? Everything that you look at with research wise proves that chiropractic is highly effective, has tremendous patient satisfaction. And how many white papers have we read that shows that chiropractic is more cost effective than medical care?
Yep.
I really think that that is going to play a role. The chiropractic is going to become the major gatekeeper of neuroimmunomusculoskeletal care, right?
Yep.
And it's going to be here on Earth, and it's going to be in outer space. My oldest daughter, not my oldest daughter, my youngest daughter, has worked for NASA. She's working on her PhD right now in astrobiology. And with all of the things we're seeing between private corporations and governments around the world with space exploration, I can see a chiropractor being involved in research in outer space, dealing with neuromusculoskeletal care, because what affects us here is not going to affect us the same way in outer space. Who knows? Maybe joint dysfunction that we can't improve upon here can be solved in a weightless environment. I can see that we're going to not only play roles here on Earth, but playing roles in outer space as we start. I may not see it. We're looking light years away before we see, planets that can be inhabited by humans. But at some point in the future, I believe that we're going to have chiropractors on spaceships that are going to be caring for people in outer space. And even research, maybe we'll learn that if we set up a certain way, a joint or the body, that it'll heal in a better fashion than it does here under gravity. I see those things happening. And I see chiropractors involved in single practices, multidisciplinary practices, and universities and medical schools teaching and doing research. I think there's many opportunities now that really weren't there when I graduated school. There was very limited opportunity.
Absolutely. I agree. I love the vision. I love it. Tell folks where they can find you in the world, Joe.
They can find me in Somerset, New Jersey. My website is drjoed.com. That's drjoed.com. That's
Beautiful.
where my home base is.
Wonderful. Any last parting words you'd like to say to the audience before we go?
I would just say get involved. Don't stay in your little cubby hole in your office. Come to ANJC functions, rub elbows with people that are maybe a generation older than you, maybe your colleagues, but get involved, because believe it or not, it's been a blink for me from the time I graduated school to this current time. A lot has transpired, but it seems like just yesterday. The reason is because it's been fun. I've enjoyed being a chiropractor, taking care of patients. I've also enjoyed being involved with the chiropractic practice at the association level.
Love it. Folks, if you like what you heard, please hit the like button and share it with your friends and family. It's really important that we get the word out to what we're doing so that other people can find us in the world. And we are literally, and I'm not exaggerating the point, we are saving lives, and we're having a blast doing it on top of everything else. So please do me a favor and hit that like button. Have a great night, Joe. I appreciate you being on. We'll talk soon.